for joining today's educational webinar with Cancer Support Community Los Angeles. I'm Abby Espinoza, the Program Coordinator at CSCLA, and I'm honored to welcome you to this week's webinar titled Brain Food, Nutritional Strategies for Cognitive Wellness After Cancer. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. Please enter questions for the speaker into the Q&A feature found at the bottom of the Zoom window. Questions will be answered at the end of the presentation. We may not be able to get to all your questions today, but we will get to as many as possible. Please use the chat feature to share comments and resources with other participants or to ask questions of CSCLA. We ask you to limit chat comments to information relevant to this topic. Urooj Riaz is a registered dietitian with 4 years experience in both inpatient and outpatient nutrition. Urooj graduated from the University of Illinois at Chicago with a bachelor's in nutrition science. Her interest in nutrition developed to help prevent chronic diseases through food and nutrition. She has extensive clinical experience in oncology, weight management, bariatric surgery, diabetes, and gastrointestinal diseases. When not working, Urooj can be found watching a new season or crime docuseries, taking a stroll by the beach, or traveling. It gives me great pleasure to welcome today's speaker, Urooj Riaz.
Thank you, Abby. Hello, everyone. Thank you for joining us today. Let me begin by asking a question. Have you ever noticed how a good meal can change not just your energy, but your mood and mental clarity? Now imagine harnessing that power intentionally, using nutrition to keep your brain sharp, resilient, and healthy throughout life. Good afternoon, everyone. Once again, my name is Urooj Riaz, and I'm excited to welcome you to today's talk, Brain Food, Nutritional Strategies for Cognitive Health for General Population and for After Cancer. Cognitive health is something we all care about, right? Whether it's staying focused at work, keeping our memory strong as we age, or supporting recovery after challenges like cancer treatment. Research shows that the foods we eat can influence brain function, reduce inflammation, and even protect against long-term decline. Today, we will explore evidence-based dietary strategies that not only support survivors after cancer, but also promote mental clarity, memory, and overall brain wellness for the general population. In the topics or the agenda and the objectives for today's presentation is, first, we're gonna learn and define what cognitive function is and see what factors impact our brain health. If you don't already know what a mind diet is, we're going to talk about that and its core components and compare mine with like other anti-inflammatory diets like Mediterranean diet, and also look into the DASH diets. At the end, towards the end, I'll summarize some evidence linking diet and lifestyle to cognitive outcomes. And then towards the very end, we'll talk about some tips and maybe some recipes. So first thing first, what is cognitive health? Cognitive health is a mental process that the brain uses to acquire, process, store, and use information to understand the world and complete tasks. Things like, so the key cognitive function includes like attention, so the ability to focus on specific information while ignoring distractions. Think about the memory, which is the capacity to store, retain, and recall information. Language that helps process, it's a process involved in understanding and producing speech and written words. Think about the perception, right? Our 5 senses. So how the brain interprets sensory information from the environment using our sight, hearing, touch, taste, and smell. Think about the executive functioning. So this is something like higher level mental processing, such as planning, decision making, judgment, and problem solving. Also, social cognition too, the ability to understand and interpret social situations and the thoughts and feelings of others. How it differs a little bit from the cognitive health is what cognitive health is, it's the ability to perform thinking tasks and maintain independence. And why cognitive function is important is like it's our daily life, right? We're learning every day, we're adapting every day, we're trying to like just make sense of the world around us. And we have seen more of a prevalence in the cognitive decline. According to CDC, about 1 in 10 adults over the age of 45 reports worsening memory loss or cognitive decline. 1 in 4 people report caring for someone who have cognitive impairment. In the US, almost 10% of adults age 65 and older have dementia, and another 22% have mild cognitive impairment. And according to World Health Organization, in 2021, 57 million people had dementia worldwide, and over 60% of whom live in low and middle income countries. Every year, there are nearly 10 million new cases. What influence cognitive health? And there are several or many factors that can either make your cognitive function operate for worse or for better. One thing is aging. We have no control over that, right? We see that there's a decline in processing speed and certain memory types, which is normal with age. Some people may have some type of a physical or mental health, like conditions like obviously Alzheimer's, which is a memory loss. Things like depression and diabetes, multiple sclerosis can all negatively impact cognitive abilities. And then something that we have a little bit of a control over, right? Our lifestyle, the foods that we're eating, the activity factor, and how we're sleeping and such. Then the other one that we have no control over, which is genetics, but sometimes we can and cannot control our environment as well. And then both your genes and your life experiences play a role in how your cognitive function develops and change over time. And then among other, there are also like the gender, your education levels, whether somebody smokes or drinks, their marital status, if they have like other morbidities, sleep duration, again, depression, and then what you do, like your activities or daily living. There are some of the so I mentioned some of the things that we cannot change, right? Age and our genes and such, but then there are some of the risk factors which are modifiable, right? And I'm not going to discuss all of them, but we're going to touch upon some of these that can help reduce the risk of cognitive decline. First thing first, let's talk a bit about metabolic diseases like diabetes, hypertension, hyperlipidemia. All of that is also associated oftentimes with somebody who has a higher weight, higher BMI, obesity, right? So what metabolic syndrome is, it's consistently linked to a higher risk of cognitive decline, especially in memory, executive functioning, and processing speed. Though some studies show the inconsistent findings. There is a relationship that is driven by underlying factors like insulin resistance, common in diabetes, inflammation, right? Inflammation could be like anything, like an infection, or sometimes like high blood pressure. Even cancer is an inflammation, and oxidative stress, something that are like also like damaging your cells, especially damaging your brain cells and the blood-brain barrier. So the early management of metabolic syndrome could be helping prevent the cognitive impairment. And like I mentioned, obesity is typically linked to many of the metabolic diseases. The first thing that we have seen, or which is common, is like diabetes, right? Diabetes is typically one of the most common metabolic conditions, right? Where the insulin production and utilization is compromised, often resulting into a excessive carb or sugar consumption. And what we have seen is that both in type 1 and type 2 diabetes, they're both associated with dementia and cognitive decline, or at least they increase the risk of that. Talking about specifically the type 2 diabetes, having prolonged hyperglycemia or high blood glucose, right, can lead to or can cause chronic inflammation. Chronic inflammation can lead to insulin resistance in the brain even, meaning that the brain cells cannot uptake glucose, which is their main source of energy. So insulin resistance can also lead to hyperinsulinemia. You're making too much of the insulin, which can directly contribute to this protein called beta amyloid plaque accumulation in the blood. And this is like one of the hallmarks for Alzheimer's. And yeah, we still need to like elaborate more research is needed in this topic. Has anybody ever heard of diabetes type 3? Well, Alzheimer's is sometimes called type 3 diabetes because, like I mentioned earlier, and we'll define a little bit more, any impaired insulin function in the brain can lead to increase of the beta amyloid protein, which is, like I mentioned, it's a hallmark protein for Alzheimer's that we have seen in the brain. It can have neurodegenerative effects, so where the brain cells are unable to access glucose for fuel can lead to neuronal degeneration and dysfunction affecting the memory and cognitive abilities. And then the oxidative stress, right, which is exacerbated by insulin resistance, also contributes to the neural damage. And then also it is part of like accumulating the beta amyloid plaque, and this is other component or protein called tau phosphate. And also like the age and everything too. While many researchers and clinicians find the type 3 diabetes concept useful for explaining the link between the insulin and Alzheimer's, however, it is not a recognized clinical diagnosis. So don't be saying that I have type 3 diabetes. It's just not clinically recognized yet. And then the other one, Kormor or metabolic syndrome we'll talk about is the hypertension, right? And how it influences brain health. So hypertension can cause damage in your cerebral, like your brain vessels. High blood pressure can damage the blood vessels in the brain, leading to reduced blood flow and oxygen supply. This can cause brain cells to die or become impaired. And it also leads to like then your body's having or have a maybe harder time clearing this beta amyloid plaque. And then the inflammation. So hypertension can trigger inflammation in the brain, which can damage the brain tissue, contribute to the cognitive decline again. And high blood pressure can increase the production of harmful free radicals, which can damage the cells. And then uncontrolled hypertension can cause this specific type of dementia called vascular dementia, and which just tends to be the second most common form. Are these two things manageable? Absolutely. With diet and lifestyle change, both diabetes and blood pressures are a significant risk factor for cognitive decline. And through lifestyle changes, medications, individuals can protect their brain and reduce the risk of experiencing mental decline. And then what is that, right? I don't know if anybody have heard of it or not. It's like a Western diet or a standard American diet, right? Which tends to be typically high in processed foods, saturated fats, carbohydrates. So somebody's consuming like too much sodium, obviously the fats and the sugar. These are the common foods, right? So sodium, red meats, trans fats, saturated fats, processed meats, refined grains, high fat dairy products, sugar sweetened beverages and or foods, highly ultra processed food items, and alcohol. Typically speaking, SAD or a Western diet provides inadequate levels of micronutrients, right, which may lead to deficiencies in zinc and different vitamins like C, E, A, E. Research also links the standard American diet with health conditions like obviously obesity, heart diseases, and stroke. Okay, so this is a nice reference or a picture. On the left is what we have is called a Mediterranean diet, and on the right upside down pyramid, we have a Western diet. Mediterranean diet emphasize at the bottom, the green, that we should have more of these items in abundant amounts, right? Which are fruits, vegetables, cereals, whole grains preferred, and the use of olive oil or healthy fats. And then at the top of the pyramid, we have like, sweets, potatoes, processed meats. So you want to have less of those items. And then in between, we have seafoods like lean meats, some low-fat dairy options, and then nuts and seeds. However, unfortunately, Western diet is just the opposite of that, right? So where we have like higher intake of desserts, sweets, processed meats, red meat, highly processed foods, and very little amounts of whole grains, fruits, vegetables, and legumes, right? So the in terms of the Mediterranean diet, it's associated with a reduced risk of chronic diseases like heart disease, stroke, type 2 diabetes, and certain types of cancer. It may also improve cognitive function and gut health. Mediterranean diet focuses on the plant-based foods, healthy fats, antioxidants that promote brain health, whereas the Western diet is high, like I mentioned, in processed foods, sugar, and unhealthy fats that contributes to the neuroinflammation and cognitive impairment. So, sort of like putting the Mediterranean diet for the mind health, I like this acronym called MIND, MIND, and it stands for Mediterranean dash intervention for neurodegenerative delay, right? It's a combination of the Mediterranean diet and the DASH diet. DASH is used for hypertension, and DASH stands for dietary approaches to stop hypertension. The benefits of the MIND diet is that, again, it helps with reduce the risk of cognitive decline and then Alzheimer's type of diseases. Obviously, it's improved your heart health and the blood pressure. It helps you maintain a healthy weight and improve the metabolic outcome and overall reduce the inflammation and oxidative stress. So going back to it, so a little bit comparing the two different diets, right? The DASH diet and the Mediterranean diet. So DASH diet, again, the emphasis on like low sodium food options. The DASH eating plan emphasizes fruits, vegetables, low-fat dairy products, also includes whole grains, poultry, fish, nuts, but is limited in fat, specifically these saturated fats. Red meat, sodium, and foods with added sugar and sugar-sweetened beverages. And then the traditional Mediterranean diet consists of minimally processed foods, which includes non-refined grains, legumes, vegetables, fruits, nuts, and fish. Some small amounts of lean meat, some eggs and dairy products are also allowed, and the modest amount of alcoholic beverage, more preferred like red wine, are included. Mediterranean diet emphasizes on the healthy fats, fiber, antioxidant intake, and it tends to be more rich in omega-3 fatty acids. All of these things we're going to explore a little bit later on. So again, just to like compare and contrast, Mediterranean is like a broader, it emphasizes on olive oil, fruits, nuts, and legume. DASH is more focuses on the low sodium, control your blood pressure. It allows a little bit more of an intake of a dairy options. And when you put it together, it's like more plant forward. Seafoods, fatty fishes like salmon, mackerel, sardines, tuna, whole grains, and then limit as much as possible on the sweet intake. Big component is also eating a lot of leafy grains and a lot of berries. And there's a reason why later on. So the mechanism that they're playing an anti-inflammatory diet plays is like, again, it's antioxidant reduces the oxidative stress, omega-3 supports the neural membranes, you're getting a lot more fiber and polyphenols, and it helps support your gut microbiome too. There's a big topic when it comes to like gut-brain axis. I didn't talk about it in this topic. I think that's a topic of itself, talking about like the gut microbiome. But just know that it's helping with that, and it's typically lower in saturated fats and processed foods. So if this is sort of like a general guidelines, obviously things and how often you're eating some things can vary from person, gender, weight too, but this is a general guideline how often you should eat different food groups, right? So for vegetables, you want to eat it every single day, at least two or more servings per day, and make one of those servings to be a leafy green vegetables. When it comes to berries, try to have it like every single day or about 2 to 5 times per week minimum. And then whole grains, you want to have it like every day, two or more servings a day. Whole grains, minimally things that are like minimally processed tend to have a lot more dietary fiber in them. Nuts and seeds, you want to have about 5 or more servings per week. Beans 3 to 4 times a week, and then seafood 1 to 2 times per week. We want to make sure that you're not accumulating just on all the mercury levels. So 1 or 2 servings are pretty moderate. And then poultry, it could be 2 times. And then each day, like you're using some type of healthy oils, like olive oil. And then again, the foods to limit and avoid are red processed meats, saturated fats such as butter, margarine, use more plant-based oils, refined grains, and then anything that's sweet, dessert types of food items with added sugar and fried foods. Uh, the focus of this presentation has been on the mind diet, mind diet and like other things too. But just as an experiment, I wanted to see if there are other diets that can help with that, right? DASH, yes, it helps with your blood pressure, so it's like a better circulation in your brain too. Mediterranean diet is helping with your overall metabolic syndrome as well. It's helping lower the inflammation. Anything that's just running high, it's considered inflammation. Having high blood glucose is causing inflammation in your body. So Mediterranean diet helps with that. In terms of the ketogenic diet, which tends to be very high fat, not so much heavy on the grains, it's experimental in the research suggests that it's not always obviously sustainable. And then you deprive yourself of your key nutrients like fruits and fiber that plays such a role in the cognitive health. And then if somebody has like any type of like B vitamins also play a role with that too, like B6, B12, or the combination of the B vitamins. If somebody is deficient, please try to like correct the deficiency. You can take a supplement form of that as well. And then later on, we're going to explore a bit more on the antioxidants and the omega-3 fatty acids and how they support the brain structure and the function. So first thing we'll talk about is the antioxidants. What are antioxidants? They are the substance that protect cells from damage caused by unstable molecules called free radical. And how antioxidants work is by neutralizing the free radicals by donating electrons to them, making them stable and less harmful. This process prevents free radicals from damaging cell membranes, DNA, and other important components of cells. Factors, I should say, that promote the free radicals are, think about your environmental factor, right? We have air pollution, the use of the cigarette smoking or the use of alcohol, toxins which are around them, high blood sugars, high intake of polyunsaturated fatty acids, radiation, and even like exposure to a lot of like sun, any type of infection. If you're having too little or too much oxygen in your body, intense. I think I was looking at one of the research, like especially like somebody who has sleep apnea, where they're not getting enough oxygen to the brain. This is a part where like too little oxygen can be damaging to your brain cells. Think about the intense or the prolonged exercises, which can cause tissue damage. It's putting more of a stress on you. And then excessive intake of antioxidant. We need to find this like a middle ground, like a moderate amount where you're not doing too much, you're not doing too little, just somewhere in the middle. So it's not always recommended to take a supplement form of antioxidants. Try to get it from the food sources first. That's what I encourage every single time. And then if you have like any type of antioxidant deficiencies, can cause or promote more free radicals. So looking into some of the health benefits are, again, to reduce the risk of chronic diseases. It helps against age-related decline. It helps improve the skin too. It boosts your overall immune system. And specifically how it helps with the cognitive function is that antioxidants protect the brain cell from damage caused by free radicals, like I mentioned earlier. It's combating the oxidative stress. So the brain is vulnerable to oxidative damage from the free radicals. And then the unstable molecules that increases with age, antioxidants neutralize these free radicals, right? It helps support it supports the neuroprotection by preventing the oxidative stress. Antioxidants have a neuroprotective effect, which is vital for maintaining healthy brain cells, especially in older adults. And then it enhances the cognitive performance. Reducing the oxidative stress at the neuronal level can directly improve your memory and your cognitive function, and potentially slow the neurodegenerations, right? Antioxidants are important, slowing the progression of neurodegenerative diseases like Alzheimer's and Parkinson's, which are associated with increased oxidative damage. Just a quick overview of where you're getting your antioxidants from, obviously from the variety of food sources, whether it's fruits, vegetables, berries, leafy greens, citrus food items, nuts and seeds like almonds, walnuts, sunflower seeds, whole grains like brown rice, oat, quinoa. We're not eating a lot of refined grains here, right? Like simple white pasta, white rice and such. And then we have legumes, beans, lentils are part of it. And then obviously, some, not obviously, but some tea and coffee are also providing antioxidants. And there are a lot, I think more than 100 at least different types of antioxidants. These are just to name a few, right? And we will explore some of them, not all of them. And the good thing is that food has combination of different antioxidants. Some fruits or foods have higher in some antioxidant, and then other are not so much in some other form of antioxidants. So for example, pomegranates are high in I can't even pronounce. It's in my notes here. It's high in tannins. Sorry, it's right here. It's high in anthocyanins, which is the antioxidants. It has flavonols, so it's part of like the flavonoids, and catechins, which is also another part of flavonoids. So there's like so many of them, and just eating pomegranate alone, you're getting so many different types. And again, not to ignore that you're getting like vitamins and minerals from eating antioxidant-rich foods. Okay, so these can, vitamin A, C, yes, these are nutrients, but they're also sometimes play a role in antioxidants. So vitamin D, how it helps is that vitamin E helps protect the brain cell from oxidative damage, while vitamin C works with vitamin E to protect neurons. Higher dietary intake of these vitamins is associated with better cognitive function and lower risk of cognitive decline. And then the food sources of vitamins A, C, E are leafy greens, nuts, all different combination, fruits, fruits and vegetables. The next antioxidant I'll talk about is carotenoids, these lutein and zeaxanthins. Typically common in, well, you find them in colors like yellow and orange, right? How it works is that it supports the brain structures. The higher levels of carotenoids, carotenoids, I don't know. Carotenoids are linked to better white matter. So we have different layers, right? We have different matter in our brain. It helps with white matter integrity in the brain, which provides connectivity between different brain regions. And lutein and zeaxanthins are dietary carotenoids. As we talked about, these are the pigments in the fruits, the yellow and orange pigments. Some of the food sources, even though this is green, like kale, spinach, they still have carotenoids in them. And then like the common foods like orange, peppers, squash, carrots, pumpkin, melons, and then egg yolks specifically, which is like very evident they're providing you with these carotenoids. The next one is anthocyanins, right? So think about berries, for example, all different types of berries, right? It comes in purple, red, blue colors. They are a water-soluble flavonoid. They're part of a flavonoids. They are responsible for giving it this vibrant color. Again, it's helping you protect your brain, and they're found in berries, different types, all different types, grapes, specifically the red ones and the purple ones. And then sometimes, like I know, like the red wine that we talked about, and the Mediterranean diet does have like a modest amount of intake of alcohol, and it does support to have more red wine than other alcoholic beverages. And then just like other foods too, like cherries, like purple cabbage or something, sweet potatoes, also have anthocyanins in them. The next one is flavonoids. Flavonoids are these large, diverse class of plant compounds with multiple benefits. Like I mentioned, anthocyanins are part of flavonoids. It's in different sources. So we got for berries and fruits, so apples, citrus fruits, grapes, vegetables, green leafy vegetables have them, peppers have them. And then also other sources, like think about like tea and coffee beverages. They also have flavonoids, specifically this one called catechins, right? So, and more reasons to like consume these, sticking with them. And like think about, specifically the green tea, as I was like doing a little bit of my research, it has this component called, and I cannot pronounce it, but the acronym is EGCG. It helps at even at like a DNA level. It helps from denaturing the DNA. So it's very important. It's high in green tea. And then especially like with this new trend, I should say, but there's like a more of a rise in the in intake of matcha tea. Matcha is part of a green tea. In green tea, you are drinking, you're getting like the extract from the leaves, whereas in matcha, you are consuming the leaves in the powder format, right? So it's a little bit more richer in the antioxidants, but either or green tea and or the matcha, they're just as good and beneficial. And then just FYI, green tea versus matcha have a little bit more caffeine in it. And otherwise you can have cacao, so like could be like a part of like a dark chocolate once in a while, as opposed to having like a regular milk chocolate which has more sugar. You can have dark chocolate to get the benefits of the flavonoids, and then coffee, and then soybeans, right? Soybeans, this component is called isoflavonous in it. So it's all in all, it's gonna be helpful antioxidant. So ending with the antioxidant, moving a little bit towards other food items, right? So omega-3, we all have heard of omega-3. It's very important for the brain health, right? Omega-3 is a fatty acid. It's essential, meaning your body does not make it, so you have to get it from the food sources. It's a group of a polyunsaturated fats that are essential for human health and are crucial for brain structure and function, and may help protect against cognitive decline. They are primarily found in seafood, some plant oils, and nuts. There are three main types. The first one, alpha-linoleic acid, or ALA, it's found in the plant-based. Like think about flax seeds, chia seeds, walnuts. And then the EPA and DHA, you get it from the seafoods. How they work, what their role is. So DHA is a primary structural component of the brain and also for your eyes. It is vital for, excuse me, brain health and cognitive function, right? It is crucial for neural membrane fluidity, which helps nerve cells communicate effectively. It supports the memory, learning, and overall brain health throughout the life. In terms of the visual development, and then also for the infant development, right? A lot of prenatals for pregnant or women who are trying to like conceive or are pregnant, they have in their prenatal vitamins, they also have components of DHA, which helps with the development of the brain and the brain structure in the infants. And again, the food sources are fatty fishes. I have there's this acronym that helps remember what are considered the fatty fishes. It's called SMASH-T. S for salmon, M for mackerel, A for anchovies, S for sardines, H for herring, and then T for tuna. And then sometimes like algae or algae oil, this is the original source which the fish is consuming, so you're getting from the fish. And then sometimes like fortified dairy options may have, like fortified milk may have DHA in it, and or eggs. Okay, and then EPA is, again, it has more of a powerful role in anti-inflammatory. It helps with your cardiovascular supports. It reduces the inflammation by regulating the body's inflammatory and immune response, which may reduce the risk of chronic diseases, like our heart disease and arthritis. It helps with the mood, right? Studies suggest that EPA dominant omega-3 supplements can be more effective than DHA at alleviating symptoms of depression. And then again, like I mentioned, it helps support your heart health. So it helps lower your triglycerides, reduce the blood pressure, and improve circulation overall. Again, the food sources are seafood. So remember this acronym, SMASH-T, and or sometimes people can take fish oil supplements or krill oil supplements, so you can get a more of a amount of EPA in it. And then the alpha-linoleic acid, it's coming from a plant-based source like seeds, walnuts, flax seeds, chia seeds. And then the body can convert small, it's not a very high source of omega-3. Let me rephrase that. Your body still needs to convert the ALA to EPA and DHA to utilize that. Getting it just from the plant, the omega-3 from the flat-based sources is not very efficient. So sometimes it's supplementing it, and or you might have to like increase the intake of these fats. But again, if you're somebody's trying to, these nuts can be very nutrient dense. So if you're trying to lose weight, I wouldn't necessarily increase, but I'll stick with the serving size, which is like about 1 or 2 ounces per day. So with that, let's move our focus on like different other lifestyle factors, right? So I'm gonna go through each of these one by one. Hydration, which is, water. Water is important for brain health communication. It helps support your brain plasticity. It helps clear the toxin and waste product from the brain. It helps supports the blood flow and the oxygen to the brain. Some studies or a study found that individuals who were dehydrated perform worse on tests requiring attention, memory, and reaction time. And then another study showed that the rehydrating after physical activity improved cognitive function, particularly in tasks involving memory and attention. So that's that. And then in terms of the exercise and how it benefits, it improves the memory. And then exercise increases blood flow to the brain again, enhancing the memory consolidation and retrieval. It is boosting your executive functioning. Exercise can improve planning, attention, and problem-solving skills. It reduces the risk of cognitive decline. It helps protect against age-related cognitive decline and dementia. And some of the mechanism that again it's using is to increase blood flow to the brain. It's neurogenesis, where you're forming new brain cells and increasing this release of neurotransmitter, how they're communicating between the brain cells are communicating with each neurons, and just reducing the overall inflammation. It is recommended to exercise for about 150 minutes per week with moderate to moderate intensity aerobic exercise. But at the same time, I also encourage patients to do strength exercises. And then combining the strength and cardio training appears to offer more or offer the most comprehensive benefits of overall brain health. So typically speaking, 150 minutes of physical activity, and you still want to incorporate like about 20 minutes or so of strength training, at least 3 times a week if possible. And then in terms of sleep, obviously, how many times like we wake up, like when somebody doesn't get like enough sleep, you're like groggy, you're unable to think properly. So sleep does play a very crucial role in cognitive function. Again, it's the ability to process, store, and retrieve information. Sleep deprivation can impair your attention, your focus, your reaction time. Um, it can make it difficult to concentrate, stay alert. Sleep deprivation also plays a role with your memory. It can, so when you're sleeping, sleep is essential for memory consolidation, right? So during sleep, the brain processes and stores information from the day, strengthening the neural connection and improving memory retention. And then in terms of the learning, sleep deprivation inhibits learning and problem-solving abilities. It reduces the brain capacity to acquire new information and apply it effectively. And then in terms of the executive functioning, sleep supports that, which again is planning, decision-making, working, and sleep deprivation can lead to difficulties with organizing thoughts, making rational choices, and managing complex tasks. Chronic sleep deprivation has been linked to the cognitive decline and dementia, and for most adults, the recommendation is to get about 7 to 9 hours of sleep on most nights, if not every single night. Okay, and then the next three we can like put them sort of like together too. So stress management, socializing, socialization, and learning new tasks. So it helps. Chronic stress harms the brain, right? So effective, you wanna decrease inflammation, you wanna accelerate that. So such as positive talk, mindfulness, learning new skills help reduce your stress level and improve resilience. Socializing, right? Strong social ties act as a buffer against dementia. Social interaction stimulate memory, reasoning, emotional regulation, while lowering the risk of depression and anxiety. And then learning through new things, right? Lifelong learning builds cognitive reserve. So engaging in new skills foster brain plasticity, strengthen the neural pathways, and enhance memory problem solvers. This cognitive reserve helps protect against age-related decline. So put at least the last three that I mentioned, put them together, right? So create this synergistic benefit. Think about like joining group classes or group activities. It will lower your stress, right? You are socializing with other people too, and you're learning something new, right? Whether it could be something that I can think of that I did recently with my family, I guess. We went to like those color me mine type of places where you go in, you can go in with like your friends and family. It's like a group activity you're building. You're also focused on like your what is like strengthening your painting skills. I was like painting this mug, but at the same time we would take a pause, we'll socialize each other, and it takes your mind away from like just like daily stress of the life, right? So together these practices promote adaptability, resilience, and reduce the mental fatigue. So putting it all together, right? Let me connect this with cancer, right? So like I mentioned earlier, cancer is an inflammation in your body, right? Your body's trying to get rid of those cancer cells from the body. Having an anti-inflammatory diet, which is a Mediterranean style diet, it helps with that. And when you put it together and you're also like being mindful that you also want to support your cognitive health, put it together with the mind diet, right? So it's everything the Mediterranean diet talks about, and also like you're not eating a lot of sodium, so your hypertension stays in check. You're also active, you're getting the exercise, and all those other lifestyle factors also come in play. And then as we talked about, not a big component of like getting like the supplements forms of antioxidants such. Try to first get it from the whole foods, right? So try to get the fiber from there. You're getting the antioxidants from the whole foods, minerals and vitamins. All of that can help also either reduce the chances of recurrence or help prevent cancers. And then I just wanted to again like sort of like connect this with like patients who are getting like active treatments, right? Like chemotherapies and such. I've often heard it, and some of you may have also experienced like chemo brain, right? So if somebody's eating well, more nutritious foods and such, it can help with that too. This is again, it's just like my Mediterranean diet may help best results with diet, exercise, and cognitive rehab. So just like a food for thought when somebody's undergoing different treatments. And then to wrap it up, I had promised that I'll share some tips, maybe not so much like the recipes, but think about like where you can get you don't want if you buy something, oftentimes like how often does it happen? Like you buy a vegetable or fruit, before you even get to it, it goes bad, right? So my suggestion is it's okay to buy frozen produce. It's picked at their ripest, so they are high in minerals and vitamins and their nutrients, so you can use them as you go along, and it's shelf stable, it stays in your freezer, and you use it as needed. Buy some produce, obviously. You can buy frozen wild caught type of salmon, for example. Try to like replace some of your animal protein with plant-based protein. You can use beans and lentils, so you're just overall getting less amount of saturated fats. And then think about like making things in batches, right? Like you can cook up some grains, you can have some soups already made where you can add all components of a healthy eating or balanced eating. So this is just like one day example of how you can eat, and it's sort of like covering all the big food groups, right? For breakfast, have some oatmeal, berries, nuts. For lunch, it could be, and we do encourage patients to have at least, not patients, people, general populations, to have at least one serving of a leafy vegetable, so you can get it in salads, right? Add some protein in there. And then for dinner, it could be like a cooked vegetables. You can cook up some kale with some sweet potatoes, which is part of a healthy grain, right? Or which has more dietary fiber in them, so it's like a better part of a starch intake, along with some salmon. And then for some snacks, we encourage patients to have at least 2 to 3 servings of fruits, or at least 1 to 2 servings every single day. That at least that's what I encourage. And then the second serving could be like just apple with some nuts or a nut butter, right? So some of the takeaways from here are that food influence our brain via vascular, inflammatory, and metabolic pathways. Mind, Mediterranean, and DASH are all evidence-based diets, and with the emphasis in mind diet is on leafy greens and berries. For cancer survivor, think about it. It's like you don't have to do anything additional to help with the cancers or cancer survivorship. You're just putting it all together basically, and then thinking about also your cognitive recovery. One suggestion I have is that a lot of this information can be overwhelming and you don't know, like, you want to make all the changes all at once. Let's not do that. Take small steps, start small. Even the modest changes does help towards your bigger goal, and then just keep working on building on healthy habits. And with that, I will leave. We have some time for some questions and concerns, I guess.
Hi, Aruj. Thank you so much for
Hi.
your meaningful presentation. We did get a few questions in the Q&A, but if anyone has any other questions to add, please feel free to add them to the Q&A. But we'll go ahead and get started. So someone is asking, is tofu considered processed or is it a good source of soybeans?
Tofu itself it's not processed at all. It is a good source of a protein. Generally speaking, just to give you a quick overview, serving size of animal protein is about 3 to 5 ounces, depending on the gender and the weight. 3 ounces have about 28 grams of protein from animal protein. Just a half a cup of tofu or 4 ounces of tofu have about 10 grams of protein. So it is a good source. You want to eat it in like a moderate amount, at least a couple times a week. It's not processed at all.
Perfect. Thank you so much. Um, what is your favorite advice for people who either can't eat foods high in the B complex of vitamins or have pernicious
Uh-huh.
anemia and chronically test low despite sublingual and other efforts to get them in?
Is this hopefully I don't know if this person is following like a just primarily plant-based diets. Um, but she did say she have like pernicious anemia. I would say, let me think about it for a second. And then they say like injections don't include the full set. I would say like keep taking the B complexes. Um, I would need to know like specifics which one they're testing low on, but with pernicious anemia, I think it's B12. So sometimes like patients might need to take injection form for a certain amount of time, and then the doctor can check your levels. If you are coming down within normal-ish levels, then we don't have to take the injection for it, and you keep taking the pill form of it. But again, it's just like having it also a discussion with the doctor. You already taking the supplement form of it. You might just need a higher dose of the specific nutrient or the specific B vitamin.
Perfect. Thank you.
It's a good one.
Yeah, and then we have another question. Someone said they have stage 4 prostate cancer. Are there any special diet foods they should eat or not eat?
Say that again, diet groups or food?
Foods.
Diet food. So there is, when it comes to like prostate cancer, there is a big research on plant-based diets. So I would say again, everything that I talked about under the foods to limit and avoid, which was like highly processed foods, meats and such, I would avoid them 100%. I would try to get a little bit more plant forward, limit the animal protein. It's okay to have some seafoods here and there, but generally speaking, like every other day or something, try to have a plant-based source of a protein so that you're promoting more of a plant-based intake. That's that. Other than that, we all have heard this like a line, right? Where shop the perimeters, not the middle, the aisles. Aisles is where the highly processed foods are, and then the perimeters are like what's more naturally occurring food items, exception to like a lot of meats.
Perfect, thank you. And I will add that Aruj has graciously agreed to share a copy of her slides. So if anyone wants a copy, please feel free to email us at info@cancersupportla.org. And then we do have a few other questions.
Mhm.
I know you gave some recommendations on foods to eat and kind of how we can eat them towards at the end of your presentation. But someone said that they get fatigued due to their treatment and don't find it easy to cook. Do you have any recipes or any other recommendations?
One thing I would say is like if you can just email me that you're looking for some recipes, I can share them directly with them. Otherwise, like think about just snacking throughout the day. If you're having a hard time preparing meals, snacking can help. think about nutrient-dense foods, right? You can have some like hard-boiled eggs in your fridge. You can have some yogurt in there. You can munch on some nuts and or seeds, which are high in calories too. So at least throughout the day, you're getting some type of nutrients. One of my suggestions to my patients often is that try to not be on empty stomach for too long. Try to eat something every 2 to 3 hours. So that's where like more 5 to 6 times eating can come in play. And whatever you can grab, if you have access to it, the energy. If you have energy, obviously make meals. Try to make bigger batches so that it can hold you over for a few days. Otherwise, just snack on nutrient-dense food items, not just processed foods, things that come in packages.
Perfect, thank you.
Yeah.
And then someone else is saying they have insomnia and lack of appetite from treatment. Um, do you have any recommendations on what to eat to help with insomnia and a lack of appetite?
Let me answer the lack of appetite part first. Lack of appetite, same thing. Try to snack on items like I mentioned, suggested earlier. That can again help you get at least some calories in. Don't be on empty stomach for too long. And then in terms of the insomnia, magnesium specifically, if it's caused by your chemo treatment, I'm assuming chemotherapy, it may or may not work, but taking some form of magnesium supplements can help with that. And then just having a discussion with your doctor if you can take melatonin. Melatonin is like one of those, just your body naturally produces it, but sometimes you might need a little bit more to help you fall asleep or stay asleep. But other than that, just try to like practice sleep hygiene. Going to sleep at the same time, waking up around the same time. You're not using like our devices or screens close to bedtime, sort of like wind down. Turn off like some of the lights or have like those like more warming lights around you, where it's not very sharp and bright. And like just again, try to wake up when the sun is out, and now it's like a little bit later too, and then start winding down and going to bed like a little bit earlier if possible. So hopefully that will, just like sleep practices or sleep hygiene, can also help with insomnia.
Perfect, thank you. Um, and someone is asking, can you please speak to any botanicals that fit the theme today and what roles they may play?
You were cutting, can you repeat that again?
Yeah. Can you speak to any botanicals that fit the theme today and what roles they may play?
Uh, Botanicals. Okay. Again, I think I mentioned that in my presentation too. I am not a big supporter or supporter for having dietary supplements. In terms of brain health and cognitive, I fumbled upon ginkgo biloba. It's one of the botanicals that was talking about memory. This study is called GEM, ginkgo biloba enhanced memory. I think that's what stand for. It was done by the NIH. And there was like it was suggesting that people were taking the ginkgo biloba for memory, and then the study suggests that it had little effect on the cognition and the memory. So even with that research, it wasn't very conclusive. People should take it or consider taking it. Thinking about other supplements or dietary supplements, I cannot think of it. Anything else? Um, if this person can reach out to me personally, that I might be able to offer more resource. Yeah.
Perfect. Thank you so much. Yeah. And then someone else is asking, what are your thoughts on coconut yogurts and other plant-based foods, such as plant-based butter and cheeses?
Okay. It's okay. If somebody's like primarily trying to be like more plant forward or being on like more vegetarian, vegan diet, it's good. You're getting the sources from there. However, plant-based options tend to be more processed, and sometimes, if not often, in terms of the composition, they still have a high calories. In terms of like the coconut yogurt, yes, you're still getting the probiotic from there, but the coconut itself, it still has a lot of saturated fats in them. It's either or, it's preference. If somebody is following it, I'm okay with that. But I feel like just like adding a lot more ingredients doesn't necessarily make a food item better, as opposed to just getting like a plain, even if it's like a animal-based yogurt, it has less ingredients in it. It's not highly processed where you're adding like combination of different fats, different what is it called? Emulsifiers and such to have that gel-like or like a different consistency and such. So it's preference. I'm okay with that. Yes, oftentimes those other plant-based dairy options, they're made with like other oils and they are healthy oils too. So it's sometimes eliminate the saturated fats, but either or, it's preference. I would do either or. However, plant-based sources are not high in protein. And it's easier to, if you're somebody's trying to like get their protein and the nutrients, it's easier to get it from the animal-based sources.
Perfect.
And you can still find non-fat options.
Perfect. Thank you. And then we have time for one more question, but someone is asking, someone is undergoing chemotherapy or radiation. To their understanding, taking any antioxidant-rich foods could lower the effectiveness of these conventional therapies. Do you know if there are any risk if eating these super healthy foods and drinks may offset the effectiveness?
Yeah, that's a very good question. I often have patients who tell me, oh, my radiologist told me I cannot have antioxidants. So when they mention that, they're talking about specifically in a supplement form. But if somebody is used to eating like a half a cup of berries every single day and they have some green leafy vegetables every single day, maintain that. You don't have to omit. I wouldn't say like start having like 3 cups of berries, but so that the amount that you're getting, it's about the same and you're not getting it in a supplement form, which tends to be higher content in the supplement form. So that's that. Keep taking it. You don't have to omit certain food items.
Perfect. Thank you so much. And unfortunately, we aren't able to get to all the other questions, but Urooj has graciously agreed to share her contact information. So you can feel free to get that from the screen right there. And then we have one final closing slide, Kathy, if you want to go ahead and share that. Perfect. So thank you again to everyone who joined us today. And thank you again, Urooj. We really appreciate you sharing all of your knowledge and being here with us today. But if you would like to learn more about Cancer Support Community Los Angeles, please visit our website at cancersupportla.org. And then if you have any questions or would like a copy of the slides, please feel free to email us at info@cancersupportla.org. We also wanted to share an in-person class that we have every Wednesday from 1:15 to 2 p.m. It is our Tai Chi class. It meets at our CSCLA location, and you can find that at the bottom of the slide. And if you'd like to register, please feel free to scan the QR code. And again, if you have any questions, please feel free to email us. Thank you again, Urooj, and thank you again to all of our attendees for interacting with us today. We hope to see you all at a future webinar. Thank you so much, everyone.